With the virus now reaching every corner of the world, countries are putting in place increasingly aggressive countermeasures. Saudi Arabia has taken the unprecedented step of banning foreign pilgrims from visiting Islam's holiest shrines. Border controls have been tightened in Greece, and the death toll in Italy has continued to climb. While South Korea has warned anyone breaching laws on self-isolation will face an even heavier fine and possibly a year in jail. Here's our foreign affairs correspondent, Jonathan Rugman.
In this Chinese documentary, the city of Wuhan seems almost deserted. The coronavirus outbreak, which began here, has killed over 2,700 people across China in the last couple of months. The health authorities say some discharged patients have been readmitted to hospital after testing positive again. In Beijing, a taxi firm is installing plastic sheeting to separate drivers from passengers, though the virus may be doubling back on itself, with infected carriers returning to China from other countries, including Iran. In Iran, the virus has claimed 26 lives, and Friday prayers in the capital and elsewhere have been cancelled. The Iranians claim just a few hundred have been infected, but the high mortality rate suggests the real figure could be far higher.
I can't decide between what the internet says and what state television says. The internet says it's very dangerous, but TV says it's nothing serious. It's just a simple cold.
Iran's vice president in charge of women's affairs is one of 4 government officials with the virus. Massouma Ebtegar's case was described as mild, though when Iran's supreme leader thanked medical staff today, he was perhaps also trying to restore public trust. Officials meeting in Saudi Arabia have placed a temporary ban on foreign tourists and Muslim pilgrims, including these people stranded at an airport in Indonesia. The main Hajj pilgrimage is not until late July, and we don't know if the Saudis will extend their ban until then. In Naples, the Italian and French leaders discussed the crisis. 2 people have died in France, but in Italy the figure has risen to 17. Soldiers are restricting access to several quarantined northern towns. And this was a remarkably quiet Milan at rush hour. Though government ministers are playing down the outbreak, an already fragile Italian economy could be pushed into recession, with even the governor of Lombardy announcing that he is self-isolating for a fortnight after one of his staff fell ill with the virus. In South Korea, nearly 600 cases are directly linked to this religious sect, which claims it's the biggest victim of the outbreak. A public petition has called for the secretive church to be disbanded. Countries across the globe are scrambling to contain the spread of coronavirus as the number of those infected continues to rise.
And shares across the world continue to tumble, with investors increasingly convinced that the coronavirus outbreak will severely hit world economic growth. A short time ago, markets in the US were down again. Share prices have fallen by around 9% in the last week. Oil prices have dropped as well, in the expectation that demand will fall sharply as economic activity in China slumps. But there was a glimmer of positive news from Starbucks, which had shut nearly half of its stores in China today. It said that 85% were now open, and there were early signs of some recovery. Now, in the last few minutes, reports say that the first case of coronavirus in Northern Ireland has been confirmed. The World Health Organization has warned the fight against infection is reaching a decisive point. More than 80,000 people have now been infected in 40 countries. Here, talk of the virus and how Britain should tackle it has featured at a summit of leading health professionals in Windsor. Our health correspondent, Victoria MacDonald, is there. Victoria.
Yes, well, this summit, which wasn't about coronavirus, but has the great and the good, many of the great and the good from the NHS here, inevitably coronavirus has come up, and it's all about preparedness. Now, the Chief Medical Officer and the Health Secretary both said today if the numbers grow ever greater, they will have to look at things like cancelling mass gatherings, that's sporting events or concerts, and also closing offices and schools. But weighing against that, the impact of, for instance, closing schools. One GP in here told me today that if that happened, they would lose half their staff. So they would have to look at doing e-consultations or consultations across Skype. Yet it turns out, as we've found out today, that schools are already shutting down because of fears over this virus.
Burbage Primary School in Buxton, Derbyshire, closed for a deep clean. A precautionary measure, they said, after a parent was confirmed to have COVID-19, the new coronavirus disease. Nearby, a medical centre was also closed. The notice says a confirmed case of coronavirus. This was one of 2 cases today. One had returned from northern Italy, and the Derbyshire patient is believed to have contracted it in Tenerife, where there is an outbreak at a large hotel. This afternoon, guests who'd been quarantined there were told they can leave. But here in the UK, the question of school closures is becoming a vexed one for the government. Dulwich Prep in South London also temporarily closed its doors today, and in a letter to parents, the head said NHS 111 has been inundated with calls since the half-term break, and the delay our families have had in accessing medical help has influenced our decision.
There are at least, I think at the last count, 13 schools that have decided to close down. You have consistently said that they don't need to do this, but does this not suggest that they are not trusting your advice?
No, we've said that there does not need to be a mass closure of schools, and that the individual decision is, of course, for the head of that school.
They are closing schools in Japan on Monday until early April. The first weeks of March, they said, would be an extremely critical period for preventing virus transmission. Specialist centres like the Royal Free in London have treated the 15 patients identified with COVID-19 so far, and the Chief Medical Officer believes there will be more UK cases.
If it does not become a global epidemic, the UK is perfectly capable of containing and getting rid of individual cases leading to onward transmission. I expect there will be some onward transmission in the UK. We haven't had it as far as we can see to date, but that's just a matter of time in my view.
The NHS has, of course, been here before with previous outbreaks, including swine flu in 2009.
Comparing the position we're in now in 2020 to the position we were in 2009 with swine flu, the principles for planning for a situation like this are very similar. So you are thinking about how do you assess the scale of the issue, how do you assess how it's spreading and the actions that you might need to take. I think the difference is that as we sit here now, the NHS is in a much more strained position overall than it was in 2009. Where we know that we're short of staff, we know that people are already struggling in the emergency department in a way that we weren't if we look back 10 or 11 years.
NHS staff at one trust are now being asked to shave their beards so masks can fit more securely. The goatee, French fork and Van Dyke are out, clean shaven is in. But the very clear message, the front line of this fight against the spread of the virus is wash your hands. Use a tissue and discard, then wash your hands again.